There are many of us in the United States and throughout the world affected with hepatitis of some form or another. I remember the first time I saw a case with hepatitis, I was maybe out 6 months, and a close patient came in and had her husband. She said, "My husband's eyes are a little funny. Can you take a look at him?" And he brought her in, and his eyes were orange from the jaundice. It was just totally amazing. He ended up having hepatitis B, I believe, and over about a 6-month treatment period, he cleared up and it was just fine. Those are not as intense as hepatitis C, but it was just amazing how intense his face looked. So my name is Dr. Giles, and I'm a chiropractic physician, and I've worked with patients for a long time. I've been in practice 23 years, and I really enjoy coaching others, coaching doctors of wellness care, of how to create wellness practices. So it's been fun over these last years to interact with you. But this is something that's just amazing to me. This just happened here, and I don't want you to think badly of my state, but this just came out, and we just saw this on national news. Over 7,000 patients have been exposed possibly to the hepatitis C, and this was in the international news. Between 2 hospitals in Utah, more than 7,000 may have been exposed to hepatitis C. So a nurse who was working at both of the hospitals, and one of her patients tested positive for the same rare strain of hepatitis C. And what was sad is that she was using, as of the last few months, only 35% of these possibly infected have come for the testing, so we really don't know how intense it is. But hepatitis C is very much passed through needles, through people who have drug issues, especially heroin. And when you're strung out on heroin, you're not thinking about what can possibly be there. You'll share a needle. It's just, how can I get my next hit? Because they get sick when they don't have the heroin. It's literally, they get sick to their system. And so generally, heroin addicts are just using to try to not be sick. So that's a sad thing, but just has happened. So let's kind of go in now to the ABCs of hepatitis. This is interesting. It's a great way to put it, ABC, because that's hepatitis A, B, and C of what we know most of, but there's now D and E as well, mostly seen, as we'll talk about in a minute, more in these third world countries. But hepatitis is an inflammation of the liver due to various layers of infection, generally virus. So hepatitis A, B, and C are viral. But hepatitis, inflammation of the liver, can be from many layers of infection. You can have microparasites, you can have large parasites, there can be anything that can create inflammatory states of the liver. And when it inflames, then our enzymes will go up, the liver enzymes will go. ALT and SGOT will raise, and we can see then there's liver death, similar to cardiac enzymes, showing that there's death of those cells of the heart. Same thing happens with the liver. So we can look for those enzymes raising as well. So because the liver is the filter of the blood and chemical processor of the body, it has a greater chance to capture those layers of infection as well as becoming infected. So it's right there. It filters it all. All the blood's got to go through the liver, and it's filtered, processed, chemical processes happening, and that's where things can lodge. And I find that the most common layer of infection, other than specifically with hepatitis A, B, or C, would be the microparasites. So microparasites are anything that you cannot see with your naked eye. So this would be done with a microscope. So flagellates and all those that are microscopic, amoebas, those things are the ones that can be filtered out within the liver. So whatever the cause or varying layers of infection, hepatitis is ultimately defined by a viral infection within the liver when you're thinking of hepatitis A, B, or C. So we usually think of viruses A, B, and C. However, there are other viruses that cause inflammation of the liver, including hepatitis D and E, as I talked about, though not common in the United States as in other parts of the world. So hepatitis E is killing people, especially pregnant women, in an alarming rate in some of the developing countries. So after the earthquake in Nepal, they're now facing a perfect storm of hepatitis, just because they've got bacteria, they've got, as we'll learn in a minute, the fecal oral, poor sanitation, and just all their water system and their sewer system, all of that has been disrupted. So they're in a perfect storm for hepatitis. So here are the basic types, what these sort of look like in a diagram. You can look through here and see that some of them are RNA viruses. So A is RNA, B is a DNA, and C is an RNA. So RNA viruses are retroviruses usually that can stay there and become very embedded, entrenched. So you can see that A, B, and C. Hepatitis D, so you can see that, again, RNA, both of these are RNA, but how fast they can come about. But hepatitis C is the one that's the most destructive, but yet it's not as virulent as B and A. So hepatitis B is one that's passed with food workers not washing their hands, the fecal material. So where hepatitis C is more blood, that's going to be sharing needles, sexual as well. They can all be passed sexually with body fluids. But the hepatitis C is the one where we see most with our drug users with needles. So disease transmission. The HIV is found in the feces of people with hepatitis A. So it's usually spread from close contact, including sex or living within the same household. That's hepatitis A. So hepatitis A virus can be easily spread by food or drinking water. So this is why it's so, in Nepal, it's such a big deal. So it's very important with food handlers. They understand this. In acupuncture, I also incorporate acupuncture in my practice. And that was one of the big things on our state board testing, our national board as well, was that to be able to understand how quickly and easily the virulence is. So virulence means that there's a lot more virus within one drop of blood of hepatitis A and B compared to C. But C is more intense, it's more deadly, it's more chronic, but there's not as many viruses per unit as there are A and B. So HBV and HBC or hepatitis C virus are similarly spread by sex, but also sharing needles, drugs infected mothers to their babies during birth, and basically any exposure to infected blood. I have a family member in my family that has had trouble with this issue and is now working through some things and getting back on target. But that was one of the things that was concerning, was as she had a baby, what happened? What was going on? Did that pass to the baby? And some of our other family members have checked and found out that the baby's just fine. But it's just such a difficult thing to have that in your life from other family members. But that can be something that needs to be talked about within our children, and let them understand that it's not just about that you're running your own self, but you can run many other people as well, not meaning to. So often there are other symptoms for the first weeks of infection. So, yellowing skin and eyes and dark urine and light-colored stools. So when hepatitis B and C become chronic, there may be symptoms for years. So it's so important to try to jump into it as quick as you can when you find out that there's a diagnosis of it, that you jump and start to work. Now, interestingly enough, and I don't mean to be angry, this family member and her other family find out that there's this new drug on the market now that they can take that cures hepatitis C within 3 months, I believe it is. But it's $70,000. Each pill, I believe, was $1,000 or $600 to $1,000 per pill. Now, of course, you and I know that it doesn't cost that, but it's market. It's where there's need, there's going to be somebody that will purchase that. But without health insurance, which most of these people do not have, you can't cure that because they can't afford it. Usual symptoms include fatigue, poor appetite, mild fever, belly pain, nausea, dark urine, jaundice. I tell you, those yellow eyes, almost orange, was just so amazing to me. Vomiting and joint pain. I had another patient that called me and said, I don't feel good. I'm really dizzy. I can't get out of my bed. And basically having all of these kind of issues, been throwing up. So I thought, well, maybe she's just dehydrated. And she was a close friend as well. So I went over to her home. My wife and I did, and her sister-in-law was there. Husband was out of town. Her bedroom was darkened because she wasn't feeling well, but she had the light on. a light over a bedstand light. And so I checked her and checked vital signs, and she said her neck hurt a bit, and so I did some acupressure and did some acupuncture as well. And I kept feeling funny that this wasn't quite, there was something else that needed to be looked at. And so I turned on my iPhone and flipped on the flashlight, and I just wanted to look at her skin for a minute, and it was quite yellow, and I'm thinking, okay, and so I brought the light back up to her eyes. Now I realized that bedstand light was very dim. But I brought the light up to her eyes, and I was almost thinking that she was a vampire. No kidding. Her eyes just glowed yellow-orange, and her liver was close to being shut down. And then I realized, you're in trouble. So I said, we can either stabilize you and walk you to the car and get you to the hospital, or we call an ambulance. She said, I don't think I can. So we called the ambulance, and it ended up that she was starting into a cancerous state, and her liver was shutting down. But luckily, we got her to the hospital. She's been treated with the Huntsman Cancer Institute, showing clear. She's had a bone marrow transplant. But when you think of hepatitis, don't always just think of hepatitis A, B, C, D, E, but also think about inflammation of hepatitis from cancers or whatever. But we have the ability to, and as we'll discuss in a bit, we'll have the ability to get in and support the liver, support the gallbladder, and help the kidneys to take the stress off the liver. These are things that we'll be working with. Okay, so when these warning signs or symptoms become evident, the damage to the liver has already been done. But remember, the liver can be regenerated. You can take a fourth of the liver out, and in 6 months it has regenerated itself. So it's highly innervated, and it has all the blood flow that it can ever need. So it can regenerate. So hepatitis symptoms are less common in children than in adults. So conventional prevention, of course, hygiene, washing your hands after a restroom, careful travel, boiling your water, cook your food well, peel your fruits. I went on a church mission down to Mexico, and we were very careful to make sure that we washed the fruit and then we peeled it before we ate it. And if it was a vegetable, it was steamed very well before we ate it. It didn't keep me from getting all kinds of parasites anyway, but be very careful there. Sex, of course, avoiding multiple partners. That's one thing that's good about abstinence, is just not contacting these things. Don't share needles, nail files, scissors, razors, toothbrushes with someone who has this disease. And some advocate vaccines or immunoglobulins for hepatitis A and B, but there is not a shot for hepatitis C. But immunoglobulin shots can boost that. Immunoglobulins would be fine as well with Hep C. Now I'm going to take just a second and talk to you about something that I do here in Utah. We're able to draw blood as a chiropractor. We're able to draw blood and also inject homeopathic. So recently I've been using an autosanguinous injection where I draw about 5 or 6 drops of blood out of the finger. We wash it very thoroughly, and then we just prick the finger and draw it right off the finger. Of 5 or 6 drops of blood, and I mix that with a homeopathic that has about 10 different homeopathics in it. One's to fight acute infection, one's to fight chronic infection, support the liver, kidneys, lymphatics, enzymatic processes. Anyway, this is a tremendous homeopathic. Mixing that with the blood, and then we also do an imprint off of our ASIRA electrodermal screening. So we screen the patient, finding out what are the issues. We then do an imprint of those radio frequencies back into the syringe. Okay, so now it's got the 5 drops of blood, the homeopathic, and then the imprint. And then with that, then we inject. This is a 10 cc syringe, and it's full. So we inject into the top of the hip 2 times on the right side, 2 injections on the right, and 2 injections on the left. That process is done once a week for about a month, and then we reevaluate and see how we've done. I'm finding some great results with very, very chronic infections. Have not done it with hepatitis C, but with Lyme's and other very, very chronic issues. The idea, and I think one of the reasons why it's working so well, is that we're injecting a little bit of blood that we've drawn out and then put it back into the muscle. So we're not supposed to have blood within the muscle. Within the arteries and veins, venules, arterioles, yes, but not actually in the muscle itself. So what's happening is the body's coming to that area and recognizing, wait a minute, we got blood here, we shouldn't have it. So the antibodies are taking a second shocked look, if you will, at the blood and saying, well, this is us, but yet it's, there's something wrong, it shouldn't be here. So these antibodies are now looking what's in the blood. And I'm seeing some tremendous results. I would love to try it on a hepatitis C patient and to see what happens there. But that concept, so if you have the ability, medical doctors, or if you're a chiropractor, or have the ability to try this, give me a call and I can kind of talk you through how to do this within your practice. The Inno-Vita formulas, you can't believe how effective that is. So you can call me and we can walk that through. Okay, going on now. Because the hepatitis B virus and hepatitis C are largely hidden, the former U.S. Assistant Secretary Dr. Howard Koh dubbed this disease the silent epidemic, because it's not. You don't see a cough. You don't see something that's you got in front with somebody that coughed on your face and now I'm sick the next morning. This is very slow onset. A lot of people don't even know they're infected until years later. So according to the CDC in the U.S., there are about 3.8 million people with hepatitis C and 1.2 million with hepatitis B. So both viruses are even more common in other parts of the world. So you can kind of look through some of these very interesting statistics. What cities or what states have the most hepatitis in them. This is kind of some fun information there for you, so you can look back on that. So for treatment, as we come in, we're going to want to look towards layers of infection. Now again, when we're talking about hepatitis A, B, or C, we're going to want to look at Virolex. So Virolex, over here on the right, has the ability to work with both DNA and RNA viruses. So again, DNA are more present, RNA are more retro. They stay around longer. They set up shop and just kind of smolter. So this will help with that RNA and DNA. But again, Bacto-X is for the bacteria, Meta-X is for the metals, microsite for the very tiny parasites. Again, I see mostly of these infections, other than the virus in hepatitis patients, the microsite I think is the one that's most prominent. The paramac is a large parasite. Those can be there as well. Now, large can be anything that you can see with your naked eye. So even a pinworm that's dislodged, realizing if it can transmutate or translocate and get into the blood supply, it will affect the organs. You can't have them in pockets. Sometimes it could be a fatty liver that you're seeing, or within that fatty tumor, or tumor is the best way to think of. Cyst could be the small or the large parasite. So that's one thing we need to pay attention to, are these different layers of infection. Now, the liver gallbladder flush is something that would be beneficial, but not everybody should do a liver gallbladder flush cleanse. So you need to determine who's capable and who can most benefit with hepatitis. That could be beneficial, but it might be so much that they're actually unable to handle the liver gallbladder flush. So you need to do kinesiology. You need to do a good, thorough evaluation. So it may be better to do a liver gallbladder cleanse after a parasite program, or after you've supported the liver, cleanse as many infections out as you can. That can bring the mojo, or the constitution up of the liver. Also, passing gallstones may spread parasites, creating difficult to treat nests. So we need to be careful when we do flush the liver that there aren't nests and things within the gallbladder that we're moving out. Now, nests, you think of this big glob of stuff. Well, it can be tiny. That can be just a millimeter in size. It could be a nest. This is what is found generally on the internet. The Epsom salts crystal program. Now, I don't like this particularly as much as just using Livergy and Galastic for a week or two, say 2 weeks, to build the integrity of the liver up, to get the energy up of both the liver and the gallbladder. And then I just have the patient do the olive or the apple juice. We have them drink a quart a day of apple juice, or you can get malic acid capsules as well. But it's the malic acid within the apples that is going to break down the stones within the bile, within the gallbladder. So it breaks those gallstones down, and then I have them on the 5th day in the morning, have them drink half a cup of olive oil with the juice of 1 fresh red grapefruit. So they don't have to do quite as intense of the Epsom salt program. But here on these next 2 slides, it just discusses how to do that. So you can look these slides over, but I don't really care for the Epsom salts as much because it makes the patient really, this is like getting ready for the amount that they're talking about here. It's just about like having them get ready for a colonoscopy. They're going to have diarrhea and really a lot of cramping and so forth. I just don't like that. So I find great results, again, with having the liver G and Galastic prior, and then for 2 or 3 days, then the apple juice for 5 to 7 days, and then on the 5th to 6th, 7th day, then you do the olive oil and the grapefruit. So this is, again, the gallbladder cleanse, showing more of how to do there. So the stone should pass throughout the day after you do that. I would repeat it again 2 to 4 weeks again, depending on how many, if there's a lot of stones. Many times there's been an ultrasound done where they can see the size of the stones. But I say do this as a maintenance about 2 times a year to do the liver, gallbladder, flush. That'll just keep things moving very well. So we've talked now about the liver G. This is, I usually take 1 to 2 in the morning and 1 to 2 in the evening in preparation for that gallbladder flush. But again, kinesiologically, arm testing, muscle testing determine how much they should use. But you want to do liver G upon rising and before bed, empty stomach, so that it has a greater chance of absorption right up into the liver. Galastic can be taken throughout the day. And again, this one supports the gallbladder for bile and elasticity. So gall and elastic, Galastic. Coltrax supports the colon and diminishes possible leaky gut syndrome, which is often part of liver toxicity. We want it to be semi-permeable versus hyperpermeable. So many times with the leaky gut syndrome, you're hyperpermeable. Too many things are getting through the colon, which should be semi-permeable. So we want to give the Coltrax to support that and repair those tissues. So we're getting less translocation of toxin and viruses and so forth. Again, liver has to take all that stress on. So if they have hepatitis C, generally speaking, if they have hep C, there's been an issue that they're not following the 6 essentials of life well. So their constitution will be low, generally speaking. So we want to try to build that up, and this is one of the major areas to work with. So Thymusure and Immunis are also very strong, very supportive of the immune system. And Immunis is coming up here in just a minute. And of course, ViroX will treat the virus and retrovirus. And along with the Toxex, of course, we want to try to pull as many toxins out as we can. IntegraCell is your antioxidants. That's the free radicals. We want to just pull as much stress and pressure off the liver as we can. So the free radicals are causing damage to all the cells, which is a normal part of cellular respiration. It's a normal part of all the toxins that we live in. So IntegraCell stops that by delivering 8,000 milligrams of type A antioxidant. Type A's, again, will knock out 1 million free radicals per milligram. So there's 8,000 milligrams per scoop times 1 million equals 80 billion free radicals that are knocked out with 1 scoop. Love this product. I do IntegraCell, I've told you this before, but IntegraCell along with Verdance, and Verdance is the fruits and vegetable formula from Inno-Vita. I'll take a scoop of IntegraCell and a scoop of Verdance with a little bit of mineral water that we have that gives a little bit of, there's different taste, different flavoring to it. And that is a wonderful pick-me-up that I'll usually have one at like 10 in the morning and then sometimes again at 3 or 4 in the afternoon. The Fulvicava is important when we're working with hepatitis C because it's a powerful organic electrolytes which help dissolve excess minerals in the liver. So we're going to try to take out that mineralization. So this is very effective at overall calcification and mineralization of tissues. So between Thymusure and the Immunis, that's going to support. Now the Immunis is more supporting of the overall immune system, where Thymusure is going to work with more of the thymus gland itself. So that's important there. But check to see which one would be best to support there. I think when you're working with the liver and it becomes toxic, you're not going to filter as well, and those filterings, that not cleansing as well, you're going to have a greater chance of cholesterols and triglycerides affecting arteries and so forth, arterioles, venules within the brain, and I think it can most definitely affect dementias. So part of what we do there would be to do the CardiR, which helps to dilate and get rid of plaque, get rid of cholesterol and triglycerides, and remove that junk out of the brain, out of the cognition. And I think you're going to see a lot clearer. So clearing up the liver and its ability to handle toxins and fats and cholesterols to make them be more absorbable, most definitely. And as well, the effect of the hepatitis is very downing. It's a big stressor. This family member has a lot of mental stressors, and just think about that. That's like a big ghost behind you, just kind of calling your name, knowing that it can take you and drop you down and drop your quality of life. So that in itself can cause tremendous anxiety and depression. So overall effects, you bet, but we know what to do. There's some very effective silvers out there now. One that I like a lot that's just come out is from Bionativus. They're another company just down the road from Inno-Vita, and they carry one where they've mixed aloe vera and smart silver. Smart silver is a very small amount. It's a nanostate. It's not your basic colloidal silver, but it's a lot more bioavailable with less toxicity. But then mixing that with the aloe vera, that's really absorbable. It's for healing. So I think that's one to think about there. But there's a lot of good colloidal silvers. But yes, for its viral effect, and it's the silver is just tremendous at knocking out various layers of infection. Because of what I was telling you earlier, I see a lot as far as I treat and just created somewhat of a niche of treating these very heavy infections, Lyme, hepatitis. I've treated some AIDS patients. Because of that, I think I see a lot. I would say probably 20 to 30% have an overall body inflammation, and of course the liver is where that's all going, the liver processing. I think the liver is indicated in all of our autoimmune issues. So when you're talking about autoimmune, so many patients, and I'm sure you all are seeing similar, that autoimmune just such an inflammatory state, and that's going to create inflammation within the liver. So shedding down the inflammation is awesome. IntegraCell helps so much with getting rid of the free radical that's creating inflammation. Of course, when you talk about diet and helping them to come off of their simple carbohydrates, there's another book that's quite interesting that I've just read. It's called Adrenal Dominance, and Dr. Platt, I believe his name is, but he discusses how adrenal dominance affects and creates the brain's need for sugar. It's constantly letting adrenal out so that the body will trick and pull insulin to pull glycogen stores out of the liver, so that it constantly is bringing up the sugar up for the brain. But there again, whenever you're doing that, you're creating more inflammatory, and that's all created because it's faking the body out to think that it needs simple carbohydrate. And anytime you put simple carbs in, you will create more inflammation because more insulin is released, and that's pro-inflammatory. So let's back that up. Severe liver inflammation, maybe 30%. Overall body inflammation, which is also part of the liver, and it's 90%. I think all of us suffer from inflammation because of what we're eating, and layers of infection. I think we all have it, and I really think that we all have, and I'm not sure what the transmission is, but I think that Lyme, not disease, but Borrelia bacterias and all of their subsets are showing up almost on every patient that I'm scanning. So I'm not sure how that works, whether it's passed, through spittle or through mosquitoes or what, but there's a lot of things that are affecting us, and I think that's another issue there too. But there you go. So a $70,000, what's that worth to you? A liver transplant is probably $250,000 to $500,000, I would imagine, from all the stress, and you bet cost of loss of normal activities of daily living. But when I was complaining there Yes, it takes them a long time to come up. Their R&D their research and development costs and their triple-blind studies and all that they do. Yes, no question. It just kind of makes me sad to think one pill is $1,000 to $600 to $1,000. Anyway, the treatment was $70,000 over that 3 months. But yes, I understand exactly what you're saying. So appreciate that comment.